Had you here with us over the last few days. I think it's just been a wonderful exchange. Thank everyone for their frankness, their honesty, their intelligence, their wit, and their willingness to engage. I think it's been a fabulous interchange. And you should all be so proud of yourselves for what you've brought to it, and not at the very least the endurance it took to contend with our very busy schedule. So I thank you. Thank you for coming. Thank you for participating. This has been such an incredible experience to put together the second Aspen Health Forum. We are so grateful to our partners at Time Magazine, who are fabulous in terms of helping us shape programming and thinking about how to really hit the next coming waves of medicine and healthcare. So thank them. I'd like to also thank our sponsors who so generously supported our efforts here today and allowed us to bring these amazing group of speakers to you. They include GE Healthcare, Pharma, AstraZeneca, and Aetna. And we were so pleased to have them involved, and I think you found their participation very valuable as well. I'd like to thank the speakers. We know that all of the speakers we had here today get invited to many, many meetings. Their calendars are very, very tight. And getting to Aspen is not the simplest of travel maneuvers, as you all know. So we thank them for taking time out of their busy schedule to come. I think we've learned a lot over the few days, not the least of which that there's a lot more to do. And we thank you for being part of that conversation. So now we're going to close with something completely different. And now for something completely new. We're very fortunate to have with us today Dr. Patch Adams and Susan Parenti. They are two of the leaders of the Gesundheit Institute. Many of you know Dr. Adams is an expert in laughter and healing and holistic health. And he founded the Gesundheit Institute in, I believe, 1971. And in that time, he's been giving free health care in a model that he thinks has tremendous implications for the way the rest of our country tries to get healthier and delivers care. Susan Parenti is a writer and an activist who has really been talking about how to empower people and empower patients. And they have been collaborating on how to find new models of looking for health reform. So we welcome you to this closing lunch, No Funny Business, where Dr. Patch Adams and Susan Parenti will talk to us about how we can break the mold and think about new insights for health reform. Thank you so much for coming, and have a safe journey home.
I get to go first. Thank you, Michelle, and thank you, Aspen, for bringing the likes of us here. It is a privilege to be here. I like to tell right off that I answer all my mail. I've never used a computer. I don't know how to use a computer. Not sure I'll use one until I'm disabled. However, if you'll go to our website, which I haven't, my address is there as a post office box, and I answer my mail right away. So if there's anything you want to talk about, please write me. You'll see I answer really quickly. Right up front, I want to say that healthcare is a human right. We partner with Amnesty International on that very issue. I want to say that, especially given the astonishing welfare that our corporations and wealthy people have in this country, that it is inexcusable that we don't take care of all of our people as a gift. That I am ashamed of my profession, that they have not stood up and demanded that we give equal care to all people. I don't understand what they thought being a doctor was, or nurse. I entered medical school in 1967 to use medicine as a vehicle for social change. I am a political activist. I went there to study healthcare reform. In the 50s, I got involved in whole systems thinking, and I wasn't a person who had to study very much. So I spent my medical school years voraciously studying the history of healthcare delivery, not just in this nation, but around the world. Because what I wanted to do when I graduated was to create a medical model that addressed every single problem of the way care was delivered in one model. I read every book I could find on healthcare delivery, and I've gotten, since then, every book I've seen published on healthcare delivery, and I did a lot of voracious interviewing. In my experience in medical school, I found these things that needed reform. The first one is the only one mentioned in anything I see mentioned about healthcare reform, and that is the cost. Even in 1967, it was beginning to be a concern. A second thing that I could see was a real problem was the whole issue around insurance. In 42 years, I've never heard anyone say anything nice about an insurance company. I couldn't see anything in the literature that said anything about it, and in my 42 years in medicine, I have seen it to be vastly expensive, controlling of the way I practice medicine, and clearly uncaring. The issue of malpractice insurance. We need the right to make a mistake. A bad practitioner should not be practicing. Everyone else needs that right. It is hard enough to be next to human suffering, clearly knowing that your tools are vastly imperfect and that patients are not really interested in following your recommendations, to think that you are responsible for making a mistake with patients. When you carry malpractice insurance, you're telling your patients, I'm afraid of you and I don't trust you. And so you live your entire career in fear and mistrust. I can say that I've spoken at 90 of our medical schools, many of them many times. I've spoken at medical schools in 68 countries. I correspond with people in medicine from 120 countries. Almost everything you'll hear me concerned about are concerns in their countries. No country is doing it well. Everyone wants more time with patients. That 7.8 HMO minute visit with a patient is inconceivable. No one is that small or dull that you think you can learn anything about a human being in that short period of time. You certainly can't build relationship. Another huge issue that is completely ignored is burnout. Everywhere all over the world is massive burnout. In fact, it is considered normal to be burnt out in the healthcare profession. That is the expected, and that's true in every country. All over the world are horrible medical and healing environments, both for the physical and mental health of people. 6 years ago, the Austrian hospital builders, WAMED, came to us, the heads of the hospital. They have 300 to 400 hospitals around the world, and they said, we hate going in our hospitals. What can we do? The environments themselves are horrible. You have to pay people a lot to work there, and patients, staff, and guests cannot wait to leave them. Complementary medicine, when I graduated from medical school, was considered quackery. There was allopathic medicine and quackery. In fact, most of them were against the law in almost every state. All of them. There was no invitation to have people try other kinds of things. One of the most painful things, and the reason that I quickly left modern medicine, is hierarchy of pay and power over. It was almost expected that doctors be rude in hospitals. I could not conceive the powerlessness that pervaded everywhere in the hospitals of my training, with the huge quantity of physicians that were brutal to the people underneath them. The cost of medical education, especially in this country, where people graduating owe several $100,000 that want to serve humanity, they have no ability to go directly to serve humanity. And by the time they paid off their bill, they may have forgotten that that's why they wanted to go into medicine. Wellness care, I can say in my medical school, wellness was never once mentioned of any kind. Maybe scurvy or rickets. Okay, but outside of that, there was never, ever mentioned. Love was never mentioned. The most important thing in life in every country, and I've polled 68 countries, love was never mentioned in any way connected to medicine, much less diet and exercise. Passion, hope, wonder, curiosity, creativity, service, the very cornerstones of being healthy, never once mentioned and never encouraged. Palliative care, burden. Anyone that takes time to care is a burden. It's a sad thing that you have to care for your parent with Alzheimer's. Oh, I'm sorry. There is no glorification of care. Care is an ecstatic experience. It doesn't mean you take that from your care experience, but it is there for anyone who wants to lap it up. All right, I was educated on the health of the individual person. Never really was it mentioned about the health of a family. I got no indication that almost every family was dysfunctional. I got no idea and no education on the health of a community. And absolutely no idea in the health of the globe, the global health. In fact, I went to medical school 67 to 71. Those of you remember that was the Vietnam years. My school was pro-war. These were doctors pro-war. It's good surgical experience. But no education in economic health, social health, educational health, environmental health, or political health. They was never mentioned as things that were important in health. The hegemony of the pharmaceutical companies never mentioned the power over that they have in the practice of medicine, the way they control medicine. And I found out that there is no medical school in the world that teaches compassion. Never mentioned in medical school. In fact, I was constantly criticized for getting too close to patients. By God, I was being friendly. Well, in March of my senior year, I wrote up a paper describing the Gesundheit Institute, work we have done ever since then. And we ran a pilot project from 1971 to 1984. Our hospital model does not charge patients. And it wasn't that we're free for poor people. We wanted to eliminate the idea of debt in the medical interaction. We never wanted anyone to feel that they owed something. We wanted them to be excited that they belong to something that needs to be recreated, and that is community. Not community of geography, but community of a nest of care. In that same flavor, we've never had anything to do with any kind of insurance companies. Why would you have something to do with something no one said anything nice about? And we also were out of control, so we didn't want anyone to control what we were doing. Probably the thing that has damaged us being funded is that we've never had anything to do with malpractice insurance. We don't have waivers. We don't have any worry about being sued. We made massive numbers of experiments because we were experimenting with things that no one was doing, and we were never sued. And we did not, fix everybody. We made massive numbers of mistakes. In trying to understand what the role of a family doctor, I'm a family doctor, was, I knew that I must spend time with patients. In fact, I knew that my ideal patient is somebody who wanted a deep, intimate friendship with me for life. I knew that that kind of relationship for a primary care doctor was especially important at a deathbed or intractable pain or chronic unsolved medical problems. So my first interview with a new adult patient was 4 hours long, and I guarantee you they never had that intense an interaction with a human being. I asked every question sensitive to life, and if I saw a single squiggly line, I asked question number 2. I insisted that I made house calls and visit patients' homes, and when I made a house call, I opened every drawer, went in every closet. God help your privacy. I invited myself to dinner. You asked me to be your doctor, and I wanted to know you. Before I thought I knew what you needed, I wanted to hear who you were. Okay, the one thing that the movie, two things sell movie tickets, violence and humor. We didn't have much violence. We had a lot of humor, and so the movie focused on this one aspect. We are and have been the first silly hospital in history. We made everything funny. We made living funny. We made dying funny. If you only have a week to live, I'm your man. Since we never, ever gave any psychiatric medicine, we were a Monty Python medical group. For example, we did barfalongs with bulimics. Just so you can extrapolate what I might mean by doing experimental work with mental health. Okay. We, from our very beginning, even though it was against the law, we broke the law, and we welcomed every kind of practitioner that came to us as long as they didn't charge money and let us watch. So a lot of the traditional things, acupuncture, homeopathy, naturopathy, chiropractic, Ayurvedic, anthroposophic, herbal medicine, bodywork, faith healing, those are more traditional, and a lot of really other weird things that we let in. And as long as they did not do it privately and did it in a sweet way, we found great things in all of them, and certainly cheaper things in all of them. In spending the kind of time with patients, 4 hours with patients, and going to their homes, we found out what my love of literature had already told me, and that was that the vast majority of adults in our society do not have self-esteem. Most are lonely, bored, and frightened, and clearly do not have a day-to-day vitality for life. And it's not a psychiatric problem. And that's why from our very beginning we fully integrated medicine with performing arts and crafts and agriculture, nature, education, recreation, social service. So if you were a single mother who was freaking out about caring for her children, you could leave your children with us for up to a week on a moment's notice. We would babysit your children if you needed that kind of break. If you were poor and you needed a car fixed, we helped you find a mechanic. That we heard what you needed, and we did what we could to care for you. We had a full art and wellness focus. Not that very many people wanted it. Cut the crap, doc, give me a pill was much more a refrain than, oh, flossing? Would you teach me? And we persisted. We created an environment. So we had dances 3 nights a week because so many people were lonely. And so we would have big dances 3 times a week to introduce people to each other. We were kind of semi-Cupid-like. Over our time, we realized that this connection to social systems, environmental, economic, political, and educational systems are so important that we need to understand those and educate people on those systems. We knew that actually the model we wanted to build is what the environmental system calls an eco-village, so that people could, to tell you the truth, we used people's diseases as a gimmick to get them into a university of human culture, to teach Friendship 101 and Wonder and Curiosity 101, to help people understand, to go from farming to cultivating, to cooking, to eating foods that were good for you. 20 years ago, and Susan will get into this, we partnered with the School for Designing a Society and started, and we had done a more unfocused education on social change, but it was a really step forward to work with people that was what their job was. We ran this work for 12 years. Oh, one other key part of our thing, that the health of the staff is as health as the patient. And so what this means is that the design of our hospital is really first focused to make the staff happy. If the staff are blissed and they love being there, they'll work cheap. And so when our new hospital opens, when people realize that it's important to build our model, the cleaning person and the surgeon will make the same salary, $300 a month, not $300 a week, as the program states. Thousands of doctors and nurses apply every year to work for $300 a month. Why? It's all in the design. The desire to practice medicine as a service, and the design of a facility so seductive they'll work there for other kinds of rewards that are available in life than money and power. So, when we closed our door, we realized in those 12 years we had 1,400 foundation rejections. We didn't get a single donation from anywhere in those 12 years. So our staff not only made no money, they worked outside jobs to pay to practice medicine. I've paid to be a doctor for 39 years, and I say that without any sense of long and hard journey or difficult task. I've never had 1 ounce of discouragement. I say that the unencumbered practice of care is an ecstatic experience. On its worst day, the unbridled giving of love and care and exchange that can happen in healthcare delivery. So, in the 26 years since we closed our doors, because no one gave us any money, we saw America rewards fame. And so, clearly they don't reward ideas. That's certainly clear. So I knew that ideas would not be famous, that I would have to become famous in order to maybe get help to build our hospital. So we had to close our doors, go public, because we'd refused publicity up for those 12 years. We don't have any respect for the media. And in these 26 years, we have been raising funds. I always thought it was tomorrow because we are, to my knowledge, the only model in the world addressing the problems of care delivery in a comprehensive model. So I kept thinking, there's lots of funding out there. No one talked with me about our work for the first 16 years. I couldn't get anyone to even talk about our work. And we are still 39 years into it saying, if people would just build our hospital, we have a model that eliminates 90% of the cost and is an ecstatic place to practice medicine. And still, we're trying to raise funds to build that hospital. Still no foundation has given us support. Still no government agency has taken an interest in what we're doing. All right. What we started to do then, as our focus in the first 12 years was the health of the individual and the family, in the last 26 years, we've had a big focus on the health of communities and the globe. So we started our global outreach 25 years ago. We were very poor in those days. What we could do, we thought, and to work for peace was to go love our enemy. It was 1985. We said, let's go love the Russian people. We started our first clown trip to Russia. We do it every year. This is the 25th year. We take 40 people. We do 10 to 16 hours a day of clowning. We don't require any training. We've taken ages 3 to 88. So any of you could come. We've taken very troubled people. We've even taken very sick people on these trips. That led 19 years ago for us to start caring for orphans there because we hated what we saw. So we now take care of 400 orphans in Moscow and St. Petersburg. Then we said, what the hell, let's take clowns into war, refugee camps, disasters. And so we've probably taken 120 trips in these 25 years. The last 6 or 7 years, because of the money I make speaking, we've been able to do 9 trips a year, 8 or 9 trips a year. And that led, after we took clowns into the war in Afghanistan, and we were at the Indira Gandhi Hospital in Kabul that had no food and no medicine, and the U.S. troops weren't interested in giving them any. We went home and took 30 tons of food and medicine to the hospital, and that started us to take aid to places as we connected with aid organizations. 5 years ago, we started to build clinics and schools in poor countries. 5 years ago, we found children with gonorrhea, 5 years old, in the Amazon, and so we've started a lifetime project there that now in its 5th year has been recognized by the World Health Organization and Pan American Health Organization as a nice model and direction for addressing these problems. So, brings us up to the present in discussing healthcare reform. Yesterday, the Congress people who were up here, they suggested there were only 3 ways to pay for healthcare delivery, none of them, to me, interesting at all, and none actually addressing healthcare reform at all. And they said these were 3 ways. I tried to introduce a 4th way, which was interpreted as volunteerism. I'm not talking about volunteerism. I'm talking about the ecstasy of human service. And so last month, Susan and I had the privilege, we were invited, shockingly enough, to speak to a weekly hour breakfast meeting of Republican Congress people. I asked them if they had the wrong number. We went there and we realized that really a lot of what we're offering are Republican kinds of concepts. That it's never mentioned the service model. For 40 years, the business greed model has tried to take care of health care. They've done an absolutely revolting, disgusting job. And they've made trillions of dollars from it. So why we would still want the greed model to think that they're going to try to care for people, I don't know. We are suggesting a service-oriented model of care. We made 6 recommendations to the Republicans to consider. And tomorrow, believe it or not, I'm doing a press conference in the Capitol with Congressman Conyers of 676 and Congressman Kucinich and Amnesty International and this wonderful woman, Dr. Margaret Flowers, who was arrested at the Capitol because she was trying to get single payer in the door. Single payer, by the way, is a wonderful thing to pay for all people in the vulgar, greedy system. It has nothing to do really with health care reform. We need to get single payer and be irritated by the cost of single payer to reform the way care is delivered.
And you support single payer?
I support single payer, absolutely. I support it as a healthy way to take care of everybody in the greedy, vulgar system and have the cost be irritating enough for us to design service-oriented models of care so that the caregiver and the patients can have an ecstatic experience in their healthcare interaction. So we made 6 recommendations. The first was them to fund 1,000 models of hospital care where they didn't even look at the model if they didn't eliminate 50% of the cost. Don't even look at them. We've eliminated 90, so we're giving them some leeway. And one little side thing is, in the old days, nurses were trained in hospitals. We think that's a really good idea, especially with our second recommendation, which was to resurrect and reinvent the old community-style hospital, where wealthy people had a wealthy person's fundraiser and raised money, and poor people did bake sales to raise money, and the community hospital cared for its community, of course. And with the postmodern, if you would, community hospital, maybe you would have community-supported agriculture programs, tearing up every other street of a community and making farms there, and having ways to integrate the care of elders and the care, the palliative care, and all kinds of educations and school systems, and converting to a 22nd century city. And using the need for local care in a community hospital as the starting point to do that. Then a recommendation, which I like, being a nerd, is develop 10 nerd centers in the country. Nerd centers would be places built of the people, by the people, and for the people, full of biochemists and physiologists and herbalists and engineers and all interested people who would develop the medicines and hospital equipment for the people as a gift to the people, so that all drugs developed would be cheap drugs. All equipment, instead of a $40,000 artificial arm, we have a $109 artificial arm, because they're well-paid people in the nerd centers, and everything they produce is there for the people of this nation. A fourth suggestion to try to deal with the cost of a quick cost of care in the particularly the big cities, dumping hospitals that take the poor and are just so strapped, and to try to have education. People want to go into medicine for service. And ladies and gentlemen, I probably know better than anyone else in the world that medical students want loving service. When I go to Japan, 6,000 medicals turn out because they want to do loving service. All over this country, they want to do loving service. There's no place to do it. So I'm recommending Cuban-style medical schools they could do 10 experiments. They could take the 10 worst city hospitals in the country, create the Cuban style as free education, paid to go there, and then to serve your community afterwards. Then I'm creative wellness centers. So many places are closing down in malls and this sort of thing. We haven't begun to imagine fabulous ways to create wellness centers where, again, instead of putting our elders out to pasture, there could be places where people could go and volunteer just to hold people who were hurting. So instead of taking Prozac, you could go pro-love and be held. And these places could be gardens and teaching cooking and have free food as well, fabulous food for the homeless. We haven't begun to use our creativity for introducing the kind of wellness that the last group of speakers were talking about, that moved it not just in the IT and the diagnostic world, but in the delivery of wellness. And finally, the craziest idea, probably, in the list of crazy ideas, Angola Prison, Louisiana, has 6,000 lifers, mostly healthy men. These 6,000 men are being punished, and they're very expensive. The average price is $36,000 to $40,000 a year. Here are healthy men that they could choose. I don't know how many would choose, but I've had contact with Angola. Let's say all of them chose, just hypothetically, to create the largest eco-village ever. 6,000 people working in an eco-village, which I don't want to go too much take the time up for that. But this eco-village could make all the generic medicine for this country, and as a little side bonus for the world, all the TB, AIDS, and malaria medicine for the rest of the world as a gift to the world. So those are some ideas of other kinds of systems than systems for the greed system of the business community in healthcare delivery. Remember, you don't have to like anything I said.
Okay, my name is Susan Parenti. I have been trained as a composer of experimental music. And if that is not weird enough, why you should be listening to that in this context. I also was lucky enough to be at the University of Illinois in the 70s and 80s when cybernetics, which is the study of information and control and systems, was being taught. It's got nothing to do with cyberpunk. Cybernetics was Margaret Mead, Norbert Wiener, Heinz von Forster, and its brought us terms like feedback came from cybernetics, circular causality came from cybernetics, recursion. And it still is it's a study of observed and observing systems. So you look at a machine, you're observing a machine, and you're also looking at yourself observing. So it's a complex system. So I was able to have that as part of my training. I am a teacher and an organizer and disorganizer at the School for Designing and Society. And I also act as the coordinator for the Gesundheit Institute's educational programs. The School for Designing Society started in 1991. Gesundheit started in 1970. We are primarily located, the school, in Illinois. Gesundheit is located in West Virginia and in Washington, and we are sister projects. We work with one another. I talk in a different way from Patch. That's part of the reason we work together. Okay. Our work in both of these organizations, the School for Designing and Society and the Gesundheit Institute, is in confronting power. Power as it shapes and maintains itself to its advantage in systems that it creates, in which it's good for the power, but it's not good for the members. Power as it shapes our language and makes us mouthpieces for terms that are not in our interest. Power as it constrains knowledge and intelligence. So this is our work, is in confronting power. And I'm talking about, as you can see, repressive power. You may ask yourself, and I ask myself all the time, in terms of healthcare systems, where is repressive power? Have you experienced it, and could you name it? That may seem to be outside the scope of why we're here, and people are thinking, oh no, an activist, ugh, one of those people. Okay, I know the reservation. But let me quote an honored colleague, and in a certain way I deliver this freshly concocted speech, which will go for, I hope, 12 minutes only, to Dr. Paul Starr. You may have heard of him. He's probably up in his 70s and 80s. He wrote this wonderful book called The Social Transformation of American Medicine in 1982. I recommend it. And he also is the editor, I think, still, of the American Prospect. It's Star with 2 R's. This book primarily talks about the development of the time in the 1800s where doctors were on the same level as the barbers and had to go in through the back door, into the powerful profession that we see it today. And he starts it with a little quote in italics, and he never once refers back to it. In a certain way, I felt he was talking to me from 1982 to now. He says this in the beginning of the social transformation of American medicine. This is what he says. The dream of reason did not take power into account. Okay, so this, what I'm saying today, has got to do with taking up that thread. And again, I ask you to think, when have you ever met repressive power? Or have you never felt you met repressive power? Okay, so how do we do this in the Gesundheit Institute and the School for Designing a Society, and what has this got to do with our subject today and the fact that we're kind of the wacky end of this conference, or the closure that's the wacky end? Primarily by educational and perturbational efforts. Now, you know educational and you don't know perturbational, and I want to make sure that I get to perturbation, because this is an idea which is linked to the public option of Obama. It's linked to the idea of incremental change and healthcare reform. And it's a strategic idea that comes from cybernetics that I find extremely useful, and we teach it. But let me talk about our educational and perturbational activities. I'm going to talk about this quickly so that I can get to perturbation. Okay, what we do in the School for Designing in the Society is give what we call health care delivery system design intensives. A whole bunch of nouns. So we don't only talk about health. We don't only talk about health care. We don't only talk about health care delivery. We don't only talk about health care delivery systems, but we talk about health care delivery systems design. So what that means is that we work with people on the local level, and everybody is local. Your local may be somebody else's global, and somebody else's global may be your local. So it's a local global thing. We call it a glocal. We work with local people who are health professionals or nurses or patients, asking them to shape a healthcare delivery system by means of their desires. We ask people to say what they want, not realistically. As a matter of fact, you get flunked if you're realistic. We ask people for what got them involved in healthcare. What is the fantastic image they have? Why do they pursue it? And now, considering that the core relationship, how do you build a system around that desire? So we are trying to lead healthcare by what we want, and not only as a way to react by what we don't want. This has been, from the responses we get and from the information we learn and pass on, successful in an activist way, meaning people feel empowered. A nurse who has dreamed of having enough time and bringing humor and a song, a small desire, shapes a system. She works in a design group with other people and with design facilitators. And we bump into the problems of how do you create a system around someone's desire. So we are continuously working. We've done 7 of these in the last 4 years. We do them in small scale and very large scale all over the country. And we talk about many of the aspects that Patch talks about that are ignored in terms of healthcare delivery. And we try to create a non-hierarchical, non-rank environment because people cannot feel close if they feel somebody is up on the ladder over them, we've noticed. So we do community work. People come. This is a great setting here, but in our particular design conferences, people do clean and cook together, surgeons, nurses, etc. I want to now quickly move to what does that mean to design, and what does that mean to design a healthcare system. The shortened version of this is that every system is there to support a core relationship. That's the function of a system. It's supposed to support and protect a core relationship. It's like a nest. There's these little eggs. That's the core relationship. And the system is there to protect, as a nest is. In healthcare, we maintain, people have said it's complicated. The system is huge. Excuse me, that's BS. When a system is huge, that's a sign that the system is no longer acting as it's supposed to do. Because if you look at healthcare, and we go to third world countries, healthcare is very simple and very inexpensive. It is someone who wants to give care, someone who needs care, some tools, time, and the ability for this interaction to happen again. That is all it is. And if you go to an African village and you see the room in which healthcare is provided, and you see the satisfaction with that relationship, you know that that is simply what we are talking about. Healthcare is in every moment. The medical system is a subset of healthcare, ladies and gentlemen. It is a teeny subset of healthcare. So people say, oh, you go to those third world countries, how poor. They don't have healthcare in Africa. They have healthcare. But guess what? They don't have our medical system. Poor them. So we teach people to scale down this bureaucratic crust, because every time systems get out of control, they look complicated, they look big, and it looks like big it, little me. I'm so small. I just work at a nursing home. I can't change anything. Bullshit. Excuse me. This is the end of the session here, but that's not so. But that is the way a system which has become hard and crusty looks. It looks big, it looks complicated, it looks like we can't change it, and it loves our saying that PR. It's PR through our mouths. It is not big it, little me. So I ask you to scale down the healthcare relation, and we call the healthcare relation a very professional technological term. See if you can geek this. We call it the suite. Healthcare is a suite. It's sweet. If you don't know what I'm talking about, you may not have ever had health care. If you go to a nursing home and see people who are working for under living wage, showing up early, an attendant, because they want to see Billy, who's in a wheelchair, who looks up and goes, hey, Joe, waiting for you. You know, this person, does it say loser on their head because they're not earning a lot? No. They are involved in the suite of care. And a term that we use, which is slightly professional, is we maintain that care is not unidirectional, not the provider being so good to the poor, helpless patient. We call it bidirectional. It's coming from provider to patient and patient to provider. It is not symmetrical, but if health care is allowed enough time, the provider reemerges as a person visible within her and his own sphere and sees that the patient is actually providing an opportunity to give care. We maintain that not only do we need to get care, we need to give care. Healthcare providers need to be involved in caring for people. Need. It's not only that Mother Teresa was such a good person. She was lucky that she had the poor. So we are trying to tilt the paradigm, the sea change. Our institute and our work is built on an invitation to acknowledge that we need to give care, not just want to. But if we don't involve ourselves in the care of others, we shrivel up as humans. The whole story of healthcare is built on the paradigm of the need to get care. The patients need to get care. They never talk about the caregivers who need to give it. So that's a switch. I took almost all my time in talking about that. Darn. Okay. All right, so we have promised ourselves and you that we will make this question and answer and dialogue. So I will just say a few more of my loud statements and then jump ahead to perturbation. That's where I will land. In this page, we just won't do. That's all. Okay. Having been here and very glad as a guest to be here and trying to behave politely as a guest and failing at times. Okay, just simply put, and in 2 minutes, if we notice, when we work with people in healthcare design, we notice that people are in a dilemma because they notice that the economic system is not allowing certain healthcare interactions. And the dilemma is this. Do we allow healthcare to adapt itself to the economic system? Or do we change the economic system to adapt itself to healthcare? That's a dilemma. It's been spoken here that healthcare systems and healthcare reform are economic issues. I maintain that our economy is a healthcare issue. Our economy is not the regulator or the judge of the healthcare system. If a system distorts and gets in the way of the core value, then you have to throw it out. The 4 buzzwords that were said here, which I'd like to get to, and you all were there when the buzzwords were said, it is coverage, cost. You were all here, so you must know those 3 words that Tom Daschle said. Okay, coverage, which is access, cost, quality, and prevention. Okay, and that was those 4 words without a sentence around them were meant to be kind of our mantra for reform. I'd like to point out to you that Don Berwick did point out that the state of coverage, cost, quality, and prevention are all causes of the system we have. They're caused by the system we have. And in our mentality, and as Patch said so clearly and loudly, and as we say, what we need to do is change the system fundamentally. And people need to ask themselves what that means to fundamentally change the system. Because cost, coverage, quality, and prevention would be way different in a different system. And in these last 2 days, I have heard people speak as though the system is fixed, and let's see what we can do to tweak it. And there have been a few people that are speaking about fundamentally changing the system. I recommend not to brown nose the organization, but the little book on stewardship that you all got is 2 years of people talking about fundamental change of system, and I would recommend reading that when you have the time. People who write are trying to save you time. They sat around and chewed things over and over again. It's social work, writing. And I was sorry that Michelle didn't speak. Again, I'm not trying to brown nose you, but I'm sorry because there's a lot of ideas in that little book on stewardship. Okay, let me get to perturbation, and then I will cease to speak. Okay. Yeah. Okay. Yeah. I could have given you a list of all the projects that we're connected to. I won't say partnered with. I don't like when a noun is used as a verb. We make a connection. We don't partner with people, excuse me. But I won't give you that list. If you're curious to know what has come out of these healthcare design intensives, I can tell you. Because we have a whole bunch of hooks and connections across the globe to people that are trying local, do it now, and tell everybody projects that are innovative. But the last thing I wanted to talk about was perturbation. This is a really useful idea, and that's the only reason I'm bringing it from Illinois to here. Okay, perturbation is used in lieu of the terms cause and effect. You use the word perturb rather than saying, I cause something. You say, I perturb something. And what does this mean, this word perturbation? It takes into account, it's from biology, that the first command of a living system, and that can mean an organization, is to preserve those interactions that maintain its existence. That's the first command of a living system. And that's also, as I say, institutions. To conserve those interactions that maintain its existence. So even as we speak here, you're all looking attentive or performing attentivity. And at the same time, you're really directing yourself to stay upright, to keep warm if you're a little bit cold. You put your sweater around yourself, to drink something if you feel dry. You're constantly in line with your biological imperatives and also your mental imperatives. You are comparing your words to what you are ready, my words to what you think. Okay, so we have this first command. This means that when we interact with each other, there's a geometry happening. Not a line, not a linearity, but a geometry. And that means the linearity used to be stimulus response or cause and effect. So if I shout at you, ma'am, I go, whoa, like that. We used to be told in the cause and effect paradigm that my shout would cause you to go, ooh, or what? You'd say something. Your behavior would be in response, an effect of my cause. Now, perturbation tweaks this in a very useful way. It says, actually, your first command was to maintain your homeostasis. And it gets perturbed by noticing in the environment a whoa or hey. So your behavior is the compensation, is your way of compensating for the fact that I have riled you up a bit. I have disturbed your homeostasis. If you're crossing a road and I go boink, boink, honk, honk, you'll jump back to the curb, not because of my honking, but because of your responding to your own command to stay safe in the presence of an environmental signal that you see. So it's triangular. First, you consult yourself in the presence of what we call a perturbation. All right, what does this have to do? I maintain in healthcare right now, very simply put, as Patch does, that we who want to change healthcare fundamentally are in a weak position. Corporations whose first command is to be legally responsible to their investors, so they have to make a profit, have gotten a hold of healthcare. It was given to them by the medical profession, the AMA. Please take over. They are now in control. They are hugely in control. And when people talk about healthcare crisis, you have to match it by looking at the financial pages, which say that the healthcare sector is the fastest growing business in the United States. So folks, we have to face the fact that we may call it broken, but for many, that broken system is signing a lot of checks, is giving a lot of money. So, and for a lot of people, it's extremely profitable. When we say 14,000 people a day are now losing their insurance, for those of us that are humane and full of justice, that's a disaster. But for other portions of the population, that is a new market. The 44,000 people who don't have insurance are a new market of customers. So this means we are in a really weak position, very weak. Thus, we cannot get the desired outcome. We can only perturb the larger system. When you perturb, what you do is try to figure out a thing to do such that the strong system has to react in a way that is new to itself in order to maintain its homeostasis. I'll repeat that. When you perturb, you try to figure out a new thing to do so that the larger system has to have a new reaction in order to maintain its homeostasis. Not the usual things, because it knows how to respond, but unusual things. So it has to go do something it hasn't done yet. And the hope is with perturbation is that the system, which is way more powerful than we are, will fall of its own weight. The David and Goliath theory. So you do this, which you've never done before. You have doctors, well, for example, these are all bad examples, but you have doctors laying in front of the hospital, not saying anything, laying, your 8 kooky doctors. Very bad public relations for a hospital. They're going to have to say something now that they've never quite said before, that these doctors were under stress or some sort of thing. All right, and then as a perturber, you listen to that reaction and you think, now what next? Okay, this is what I think we can do. We can perturb the system. When people talk about incremental or that this is a dialogue or a process of change, I think so. I directly asked people, I asked the Honorable Billy Tenzin was his name, if it would be possible for pharmaceutical companies to give up their profit, and he said that there was no way. So we're not going to see that, at least under my invitation. The public option, and this is what I'll close with, the public option started by a poli-sci student in 2001, Stephen Hacker, was meant to be a perturbation proposal. And that had the idea that you cannot convince business to care about the uninsured. They're really not interested. They're corporations. So all these moral arguments just go poof right over the head. But if you say to business that we have got a public plan that's insuring 143 million people, that was the original scope of that initial idea, which is run by the government, though the care is directed at whatever it's Medicare like, then businesses would be perturbed because now you're on their turf. Now you're showing a business model that's working better than they are. It's costing less, covering more people, delivering better care. This was meant to be a perturbation, the public option, not a final result. I have the quotes from Obama. He said it Thursday, July 23rd, He explained to somebody at the press meeting, if we wanted to cover everybody, ladies and gentlemen, we would have to have what is called the single-payer system. He said this last week, 2008, August 19th, Wichita, Kansas. He said, if I started all over, we would have single-payer. We would cover everybody. So we have a president that wants us to work with him, and he works with us, to keep pushing the perturbations so that we may get systems that are according to our desire. So I want to remind people, in the moment the public option is being dismantled, it'll cover 10 million people. The happiness we saw, I maintain, and this is probably scandal and libel, of the representatives and the pharmaceutical people is because now it's not going to be government run. Now the private insurers are going to insure those 10 million people, and there's more business for them. So the public option is losing its steam. There's the hope that if single-payer activists and public option people come together, we can continue to cause a perturbation. So I want you to keep the idea of perturbation in mind. We are not going to see the outcomes we want now, but we could perturb the systems, the predatory systems, to come to outcomes that we would be surprised at. Thank you. 35 minutes left.
Yay! Now we get time for questions.
Yeah, or for you to hear yourself
or
say
comments.
Something. Disagreements. Ma'am.
See, it's on. I wrote some notes, and I just want to share some of my experiences. I had gone through medical school. I graduated 15 years ago. And I feel like health is related to education. I've seen people with a lot of money who don't know how to be. I really appreciate that people are focusing on education. But I wanted to run through. These are things I think that the general public doesn't know. Patch probably knows, and you probably know, that the smartest students go for the lowest hours. So they go into ophthalmology and dermatology. So it means they got the best test scores, which wasn't me. And on a regular thing in medical school, I would have to be in at 5 a.m., and I would work through the next day until 5 p.m., and if you were on a surgery rotation, that was every 3 days. And I just remember being so tired I couldn't even think. I graduated with $160,000 in debt. And once you consolidate it, you can't reconsolidate it. So even though some of my debt was at 9% and some was at 7.65, so when it dropped to 3% or 2%, it was too bad. You can refinance your home, but you cannot refinance your educational debt. When I was in medical school, 6 to 8 students got caught cheating. They used to give the scan tests with the pencil thing. And students always argued to get more points, so they'd give you back your test. And if you had some of the now right answers, you'd get extra credit. And they had, I think it was 8 students who cheated. I was just about barely passing this class. Students who had Bs who were trying to get As. And they got caught cheating. And some of them threatened to sue the school for entrapment. So the school did nothing with them. They would never have that on their transcript, and they're out there practicing. And as we heard Dr. Oz say, the best indicator of a bad doctor, somebody who shouldn't be associating with patients, is somebody who's going to cheat at that level. And I went into the dean of the medical school, and I said, wait a minute, my friend failed anatomy. I'm barely scraping through here, and their resumes are going to look better than mine. I don't like that. And she said, I can't discuss this for legal reasons. Ethics. I had said before, my undergraduate school had an honor code. Nobody monitored us to be quizzed or tested. The teachers actually had to leave the rooms. In medical school, they can set a camera on people. When you take your boards, I mentioned that a proctor follows you into the bathroom. So you're supposed to be making decisions on people's lives, but you can't be trusted not to advance your own agenda. I wrote a paper in medical school on ethics and talked about the cheating, and it was rejected from a contest because it said that character and integrity were not an applicable topic. Let's see. I remember sitting in a group of medical students and a group of guys and a few women, and a male medical student said that date rape was the figment of a woman's imagination, that everybody knows that sex is like pizza. Even when it's bad, it's good. And these were people out there touching people who are sick and scared. I would probably, when I was in the hospital, I probably was crying weekly in the bathroom by myself over some death or illness or pain. There was nobody to talk to me about it, and what I saw is other students cope with that by just hardening. There's nobody to really address. You're 18, you're in college, you're in medical school, and suddenly you're told to go tell a 60-year-old woman no more chemotherapy is going to work for her, and go see her sister because this is her last trip. I saw students come in. A lot of them care, but some want status, control, and financial stability. And then you have introverted scientists who really don't want to connect with people. And I learned a lot about the human body but I didn't necessarily learn a lot about healing. And so I just wanted to share those thoughts with you. Thank you.
Thank you. Thank you.
I've heard those students in 120 countries. You're in a big club.
Yes, sir.
Yes. How would you react to a statement or a definition that good health is simply the slowest road to die?
Well, if that's a definition. I mean, I don't know what you're really asking. For me, good health is a different model.
Yeah.
And there are a lot of people, as was shown in the last set of lectures, virtual dying at 91 and breaking most of the good health rules. I mean, I define health as a happy, vibrant, exuberant life. That way you can be dying that week and be healthy. And because that's worked for me. And I think that, another person would define it as lab values. I think hopefully each person finds a definition that works for them and strives to be that definition. And modifies it if they actually decide to change it. If you don't ask questions, I recite poetry.
Did you have? Yes. Yes.
I do, yes. How are you? So I guess health, the current system is affecting everyone, not just the 40 million that are not in it. So everyone here in this group seems to be actionable enough to be here in the first place. So the question is, and I'm taking from the Aspen Ideas Festival month, what can each and every one of you do that will actually make an impact after you leave here today? So.
Is that an answer to what he has to say? Let's let that. Let's hear. I'm curious. This is a good time for reflection.
Patch, thank you.
Oh, wait, that's not an answer to what he's saying.
It is.
It is an answer. Okay, so it's this way.
I'm going to address it to a triangle.
Okay, triangular.
My husband was in medical school in Washington, D.C. when we were reading about what you were doing, and a lot of his classmates went to rural North Carolina to make a difference. I'm coming to you there. And in Ohio, we took chickens and wood and apples for our practice, and a great percentage of money we did not. And my husband could not be here today because he's in surgery. He's on call. But he wanted to say thank you. And he's on Governor Ritter's committee to try to create health care reform. And we met with the head of the DNC last week. And Susan, for the economy stimulus package, we asked Governor Wade if he would please go back to Barack Obama and state to him that we have stimulus packages, which are whatever you believe, they're necessary or not. Similar to AmeriCorps for teachers, could we please, with a stimulus package, whether inner cities or rural communities, take
Wonderful.
buildings and create clinics? And you see that young man playing basketball on the graffiti field. And somehow, if he wants to go to medical, or she wants to go to medical school, create a AmeriCorps. You go to medical school, we'll pay 4 years, but you must go back to the community
Super
and
idea.
let other kids see what you're doing, so that you're creating a clinic that is. And so we're trying to do this. We're trying to. We spoke to Governor Wade. We spoke to Congressman John Salazar. We spoke to John Dean, trying to see if they could take this into the governance and legislative action.
Wonderful.
But I want to thank you very much because you were, Patch, a stimulus to many medical students in the 70s and 80s who are now in rural parts of this country.
Wow.
Wonderful. I'm here to stimulate or to irritate.
Let's put it out. ELAM is the Cuban International Medical School. It is free for North Americans. We need to know this. Obviously, people have a hardened heart about Cuba, though with Obama I think we're going to soften there. But also in Venezuela, there is a medical school, you have to speak Spanish, unfortunately, that takes room, board, and medical education for 4 years. The only commitment has to be that you go back to your community and you work with that community in need. And we have been using many of the graduates who have come back, very well-spoken young women from LA, New York, et cetera, who are now physicians, who have gone through ELAM. So if you know of someone, in addition to this great idea of AmeriCorps, super, and I'm writing that down and put it as part of our documentary bank, I suppose. Think of ELAM. Have them Google ELAM. Okay, let's still answer this gentleman's question. That was one. Thank you very much. Do you, ma'am? Yes.
What can we do to change the paradigm? and to be a part of the paradigm shift. One of the things that I'd like for us all to do is just a little role play. Let's assume that as a result of our 3 days of discussions, we do have that ideal healthcare professional that will go out and do the things that we've talked about. What we're finding, and I have a colleague who has been in the world of really compassionate care, who is now being filed on by the Board of Medical Examiners and losing his license. And so I sense that we're going to have to come from the grassroots and let our congressmen, let those who are in power. I'm not questioning the integrity of what I've heard this week. I think the intentions of the regulations are pristine. We don't want someone to be given a capsule from another country that's full of horse manure or sawdust or whatever it might be. So the standards are honorable. And the challenge, I think, we'll all go away from here embracing and pondering and hoping we can solve is how do we interface, how do we bridge the gap between the old paradigm that's not working, that's circling the drain, and the new, and we know there's going to be growing pains and labor pains. A friend of mine says we're going to be going through the birth canal, and there's going to be contractions and all kinds of pain. To do that ethically, maintain the licenses of those that have gone to school and really are credentialed. I'd like to hear more about that because it's going to be tricky to maintain the standards of the Board of Medical Examiners and yet embrace some of the paradigms that we know would be delightful to include.
Do you have, ma'am, an answer to what this woman?
If you act in community, and there is an association called the American Holistic Medical Association and the American Holistic Nurses Association, and the voice of many is so much louder than the voice of the one. And yes, you could go into your community as I did, 30 years ago, when I was the only holistic nurse at a large teaching institution, Washington University. And once I got the American Holistic Nurses Association and the Medical Association behind of what I was saying for taking care of community, it was so much louder, because if I was just saying that, yes, I have a certification in holistic care, they'd go, so you're just one person. But if I said, I'm taking 21 nurses who work on this floor to the national and international meeting of the American Holistic Nurses Association that's backed up by the American Medical Association and the American Nurses Association, all of a sudden they said, oh, really? This is something that you do? So it's out there. It's been out there for 25, 30 years. We just need more people to say, hey, let's get on the bandwagon. So if you want something, a voice of one is not as loud as when that voice gets all together.
Thank you. And also, if you have, I like this as a basis premise, but we're also curious. We kind of left several lampoons. If you have questions for us, let's interweave them between what you're asking about what people could do one by one and whether there's any response to the things that we had to say. Yes, ma'am.
Well, first of all, I just want to say thank you so much for spreading your idealism and your passion for healthcare. That's really, it's refreshing to see, so thanks. I am getting my MBA in health administration, and I also have a healing arts practice. So I do a lot of different things, but body work and energy work, and I teach meditation. And I have to say, I think a lot of the power of transformation is going to end up coming through, I don't know if you all saw Adam Bosworth speak, but people like him, entrepreneurs, creating businesses that they feel like are socially responsible and socially just, and that there's nothing wrong with making money doing that. And I just want to, kind of in answering your question, I think that there's a huge movement that we don't recognize enough that is people, I guess, like that have a vision like I have, but they're working quietly but diligently to create their own business that will create this change that you're so passionate about. So, yeah, I appreciate your...
And what would be the role, then, of people who would like to be working for free? I mean, is this a paradigm shift, trying to make money off of healthcare? Help me understand this, because this is a little bit what we're questioning.
For me, in my private practice, I see money as an energetic exchange, and that, I do experience ecstasy in my healing work, but also money is just a currency, and I deserve to be reimbursed or given something for the services that I provide. And for me, it's not just enough to do it out of charity. So if someone gave me some, food or lettuce or whatever, I'd do it too. But
and how is that different from corporate care? When is the distinction? This is a legitimate question for me. I agree that earning money is important. I used to be a labor organizer, so this is crucial. Yeah. I just wonder when some things become corporatized, and to what degree your particular effort can be against the huge corporatization that we see.
This was a little bit of my hesitation with but I still appreciate the perturbation kind of discussion that you created. I don't think that it has to be against. I think that it can be in line with, that you can do something in harmony with, these corporations can coexist, and like you said, you shake them enough that they fall of their own weight. I don't think it's something that we have to fight so hard against as much as, I just see, a lot of creation more so than
resistance.
Resistance, yeah.
Okay. You have something to say to that?
No, I'm interested in what people are thinking about what we said.
Okay.
So.
All right. Man in front, and then man in the side, man in front. Yes, I think we have to move that mic.
There's also this fellow here.
Hey, I really enjoyed both your talks, and they got me thinking how similar these things and these problems are. Medical school in Uganda, and I must have gone into medical school with a lot of passion. But by the time I left the medical school, I had been so tortured. It's like we have accepted that going through medical school should be painful. You should suffer. You should be failed and redeemed. And so how are we going to change that? Because I think it's okay to fix the system and the economy. But how can we work together to grow a workforce that hasn't been traumatized, that hasn't been through this grilling, that still has the fire and the passion, and yet is still strong and of high quality? I have seen the same thing happen to my daughter. She's just graduating in September. She's gone through the same thing I went through, and sometimes I think worse, because now the competition is really, really tough, and she's in Europe, so she has to push. So are we going to go through this cycle generation after generation and do nothing? Or as a profession, are we going to go back to the basics and change the education system and teach differently and let people graduate when they still have their honor? Because I think once you've lost your honor as a medical student, you've lost it. You can't get it back as a doctor. What can we do as human beings and as doctors and as teachers at universities and people running medical schools and deans of medical schools are all here? Because it's really a fundamental thing. I think it actually tortures the medical student so much that by the time they graduate, if they were graduating to be bankers, they would never be bankers. Whatever you were graduating to be, if the school system took you through what medical students go through, you would never be any good.
I think a huge amount of work with medical students. Again, as I said, I've spoken at medical schools in 68 countries, and many medical students come to many of our events from all over the world. You're talking about a universal problem of medical education. It never hurt me. As a matter of fact, I disturbed them. So I think we try to set an example and offer ideas for how to survive, not only survive, but actually delight in the and delight in the experience, and partly by being a perturbation rather than a victim of the medical educational system. And I think that's how to deal with the problem now. And I know my style would be to make new medical schools, to work with, in this country, American Medical Student Association. They do an annual health justice retreat with us and have for some years, and that you offer that it doesn't have to be that way. It's not the rule to suffer in medical school. I promise you, I never suffered any in medical school, but my school suffered for me being there. And that I was a perturbation in my medical school. And so I think you, one, set your own example, work with medical students and say that this isn't what has to happen, and have ideas for how it protects an individual medical student, and let that out in the medical student world. And we go to the American Medical Student Association's annual meeting. And so these are ways that we are doing it. And then, of course, infiltrate the medical school and erase that possibility. I think a larger picture is what we're trying to do with the delivery of care, and that is to have medicine come from a non-hierarchical joy of service base.
Yeah. This direction? Yes, ma'am.
Yeah, hi. It's Rebecca Waldorf from Pharma. How are you?
Hi, Rebecca.
Hi, Patch. Thank you so much for coming out. As someone who is in Pharma's Alliance Development team and relatively new to Pharma, as a sponsor of this conference, as we were looking through the agenda, I actually thought it would be terrific to have you come. And as you know, I called you personally and invited you.
Thank you.
And not only that, I think I had to encourage you a little bit to come out. And I think that given the impact that you've had and the different voice that you've had over these days, I'm personally really glad that you did it, and I think everyone else has had an alternate view, frankly, from the majority of what people are saying. So thank you for taking up the offer. My question is, and Susan, you mentioned this, Pharma and a couple of other kind of the big corporations like Eli Lilly and Blue Cross are actually the sponsors of the recommendations. And you've had an opportunity to ask our CEO some questions, and I think there was, at least from a panel perspective, some dialogue. I know I was in the conference with you when you were talking to Billy. My question is there any room for dialogue and negotiation with this kind of big business, again, on behalf of Pharma, or in your mind, is it just too much ingrained problem money-making for any kind of working relationship?
Thank you for asking. Thank you. It's perfect.
Thanks
Thank you.
for helping me get here. If I had a reluctance, I'm almost the sole support of our work. So going places that are wealthy like this for nothing are problematic for the survival of our community.
No, our expenses were paid.
And I'm on the road 300 days a year for 26 years to make sure we don't fold. So it was a thrill to be able to come to a place and offer our ideas. It just was figuring out, signing away another 3 days of that time. Well, you heard, I mean, pharmaceutical companies, there hasn't been a positive book written about them in my lifetime, and that they have the highest profit margins of any transnational corporations. And you heard my solution, which is nerd centers that would make medicines as a gift to the people of their nation. So I stand by that. I actually don't think there's a place for business in the care of our citizens. I think that to work it out, that it is in the same way that I would work it out for my greater extended family, that I don't think there's a place for market capitalism in the care of people. Partly because it's a very vulnerable position. When I was in medical school and long after, you hear people say, spare no expense. I want the best money can buy. Often it isn't the best, most expensive. And so I myself would wean out the pharmaceutical companies. Because if you're going to profit from selling medicine, you will force yourself to lie about the results, which is universally known in pharmaceutical world, that they misinform, they lie. If you sell $15 billion worth of pills and you're sued because it's not a good pill and it costs you $2 billion, you're still doing well with lots of billions. And so it's just, I feel I'm always speaking for the people who can't afford those pills, and that's who I'm speaking for.
Could I answer? This question and your position and the sponsorship of this conference by, people that when I saw these banners, it was like, oh my gosh, okay. Because in other worlds, if you work with politicized medical students, some of the sponsors would be pied in the face. And so then one says, though, but however, they're sponsoring this great forum, so great. All right. And we know that these companies have large budgets and also want to be involved in the attempt to reform what's happening. Though, again, in my perturbation model, there are homeostatic levels with corporations. There's no question. People talk about socially beneficial corporations, and I think I'm addressing you, with the notion of we can have corporations and they can be socially beneficial. If you track them over time, though, they don't compete well on the global market. And so they go down. I don't want them to go down. I would like there to be a level, I would like there to be big business. Big business can do a lot of things that small business can't. I don't know how to solve this problem, actually, because I just see it as being incompatible. There are good people in pharma. There are wonderful people in the big insurance, wonderful people. The question is, if we're thinking on the level of system, if those corporations have to be responsible to investors, how can they also be responsible to other considerations? And we see this problem all over the place. And maybe if people know, and I think we've got to create some solutions. In the true dialogue mode, we would be going off with each other, and all of us for the next 2 years, trying to carve, we say this, you say that. Okay, good, that's point of departure. What's the next step? I feel we radicals hardly ever talk with corporate people and vice versa. We're not in the same room. It's not only what's the elephant in the room, but what's the corporation in the room, and we never get a chance to talk and figure out. And it may be there isn't any point of common ground. I don't know, and maybe other people. The booklet, the wonderful stewardship booklet, didn't touch some of the hot spots that may have been, that would turn off big pharma or time, but that may be very well strategic. Institute for Healthcare Improvement does not talk about stopping big business, and they're doing fantastic perturbation work that maybe don't touch the hot spots of big business and make them say, that's fine. You want safety? Fine. So it may be that there are back doors of ways of making some kind of cooperation, and maybe not. Maybe that's what the future of humanity is going to have to figure out, Rebecca. Thank you. Yes, sir.
Hi. I'd like to talk about and ask a question about a time that I came out of. My dad was trained as an osteopathic physician in the 50s. As a little boy, I remember him always carrying his little black bag with him everywhere we went. And he had a little round thing on the back of our car that had a green cross on it. So he was identified as a physician. And he took his Hippocratic oath very seriously, so that if we came upon an automobile accident before EMTs were invented, he would pull over and he would attend the person. And there was no malpractice insurance that he carried, not to my knowledge. And in the little town of Watertown that I grew up in outside of Cambridge, Massachusetts, he was the police doctor and the fire doctor. And it was a very large Armenian community. And people came to really, love the fact that the home calls and so forth. I mean, that was the world that I came from. And I'm wondering, in terms of the word perturbation and taking it from the perspective of those that are going into the healthcare professions and are studying to become physicians, and the motivation behind why we do that. Is it because doctors end up being very wealthy in this country, or is it because of what Patch has been telling us about this morning, more from that sense of giving and care, and what the true meaning of care is? And I'm just wondering if we can talk a little bit about a return to those days, because I remember at the end of his life in the 70s, he did a lot of home deliveries. I mean, he was an osteopath, but he was also a surgeon. Right. He had the full training of all the medical doctors, so he had both understanding, and he would do home deliveries. I mean, hundreds of women would come and want to have my dad deliver their children, and so. And I was lucky enough to go to a couple of those and see the miracle of life, but not in a hospital context. But that doesn't happen anymore. And so what I'm wondering about, to try to bring it back to, the true meaning of health care, and how do we inspire the students in our country? I don't know how many physicians there are in the United States or all over the world, but I'm sure that there's a number, whatever that is, 150,000. How do we influence a sort of a return to that type of thinking? That's the question.
Well, I would say that's 100% of our work. I think that's why we have been so active in AMSA, American Medical Student Association, and why we haven't given up. It's amazing to me that even though we're not built, not seeing patients, that hundreds of thousands of medical students are inspired to be their fantasy medical student, medical doctor, because, as you said, your husband, that they're inspired. Every day, from letters and calls, I hear about it. So we're hanging in there, and well, actually that's incorrect. We are ecstatically moving forward. We're not hanging in there, and we know it matters, so we think, were we to have a hospital operating on less than 10%, where people are loving working there and able to be their fantasy doctor, that would be an increment increase in our perturbation. And so I hope the people here, if any of you here know anybody that would like to help us build this model, you'll be an immortal force in the history of healthcare delivery.
I like to end on time so people can catch their flights, but I like to stay and ask questions. But I think what you've witnessed this afternoon is the beauty of what the Aspen Institute was designed to do, which is cover the full scope of ideas and controversies in a field and bring together different people to have discussions and perhaps disagreements. So I thank you so much for helping us in that arc.